Hepatitis C. Etiology, pathophysiology, and pathology. Hepatitis C virus, HCV, is an RNA virus that is parenterally transmitted, most commonly by percutaneous exposure to contaminated blood. Sexual transmission is possible, but not common. HCV infection occurs in 2 to 8% of infants born to HCV-infected mothers. Most of those infected develop hepatitis 14 to 160 days after exposure. Epidemiology. In the UK, 0.1 to 0.5% of the population have been infected, but in some countries the prevalence is much higher, e.g. up to 20% in Egypt. Clinical presentation. Most cases are asymptomatic, perhaps 20% develop a mild acute hepatitic illness, but jaundice is rare and symptoms are less severe than with hepatitis A or hepatitis B. In the long term, 85% of patients fail to clear the virus and have persistent viremia. Many of these develop slowly progressive chronic liver disease, and over the course of 20-40 years progress from acute to chronic persistent hepatitis, to chronic active hepatitis, to cirrhosis, in 10%, and eventually hepatocellular carcinoma, 1 to 4%. Physical signs. There are typically no abnormal physical signs in the acute stage of infection. Signs of chronic liver disease develop later in many cases. Investigation. Liver biochemistry. In acute infection, alanine transaminase, ALT, typically rises to about 10 times normal and the bilirubin may also be increased. In patients with persistent HCV infection the ALT fluctuates indefinitely, but bilirubin returns to normal, until the development of advanced chronic liver disease. Evidence of infection. HCV infection is usually diagnosed by testing for HCV antibodies. If positive, this is followed by testing for HCV RNA, providing an independent method of confirming infection and determining whether it is persistent. Liver biopsy. The acute hepatitis induced by HCV is generally less severe than with the other hepatitis viruses. In patients with persistent infection the histological findings can fluctuate, but scoring systems that typically quantitate necrosis, inflammation, and fibrosis remain the best predictors of outcome and are often used to decide whether to offer antiviral treatment. Treatment. Pegylated interferon alpha with ribavirin are effective but expensive and often difficult for patients to tolerate because of side effects. They should only be administered by specialists in accordance with recognized protocols. Prognosis and complications. HCV infection is one of the commonest causes of chronic liver failure. Rare extrahepatic manifestations include membranoproliferative glomerulonephritis and mixed cryoglobulinic vasculitis. Prevention. There is no vaccine for hepatitis C, hence prevention must be by reducing exposure.